Kaiser, Northern California patient, I've been incredibly impressed with the cost. My cost as a multiple myeloma patient has been extremely low. For a 21-day supply of pomalidomide, for example, I pay $35 copay. For a 3-month supply of dexamethasone, I'll pay a $10 copay. For my autologous stem cell transplant, that must cost well over $250,000. I paid well under $10,000. So the cost has been incredibly, surprisingly low. And the value has been tremendous. I'm still alive 5 years past diagnosis. And thank you. I have an incredible quality of life. But beyond the cost, the dollar value, the dollar cost, that is the next biggest consideration, is the quality of life. It doesn't matter how long the life is extended if it's not quality.
I have a similar situation in terms of insurance. I'm employed and my employer picks up a substantial portion of my payments. So the financial impact so far has been relatively small. In terms of quality itself, I think there are three things that I'm really looking for. One is quality of life. Two is survival. I want to survive as long as I can. I really am looking to survive towards the next major excuse me, I'm really trying to survive long enough so that I will be around for the next change in modalities that occur. So I'm looking for the current things to come to fruition as quickly as possible. And I'm willing to take certain risks personally to do that and participate in clinical trials for that purpose. In terms of big data, in terms of educating myself, I've been doing that. In terms of big data, I'm participating in the COMPASS trial, which is for myeloma, and it's a long-term longitudinal study of individuals and their responses to both the drugs and the cancer itself. I think for me personally, the most personal thing is I want to be around long enough so that I can launch my daughter into the world. She just graduated college, so I made a major milestone with that. Now I'm hoping to get her situated in some employment situation.
I was diagnosed with CLL in 2005, and I was kind of anomalous. I was in my 40s. I was younger than most patients and quite ill, so I went right into treatment. At the start of the process, value for me was doing whatever it took at any cost, both financial and physical, to get better. But one thing I learned quite early in the process that has affected the way that I look at this is that this is a long-term process, and I will be having ups and downs of being well and sick and well and sick and well and sick. And so one of the things that one of my doctors said at the very start was, I can't give you a definitive answer. I can't, this is not a cookbook approach. So I can give you data and I can assist you to make a decision, but that's the best I can do. And so one of the things that is valuable to me right now is information. So do I need to have a scan? Do I need to have blood work? Is the result of the scan, is the result of the blood work going to make an impact to what's going to happen with my care? Is it going to impact my life? So that's how I kind of view things, because I'm kind of in a cycle where I'm fine, but I'm waiting for the next big event.